Greetings to all True Diet viewers. We have yet another knowledge packed series on holistic nutrition and wellness from women and child development. This time we have experts not just from nutrition but also from physio, psychology and spirituality. Hope you will benefit from their wisdom. Today we have dietitian Kiranmayye, who is pregnancy and childcare nutrition expert. Let us learn how nutrition is important during preconception and pregnancy. Why is preconception nutrition more important?
Okay, so maternal nutrition must be optimized before conception so that the pre-implantation and early differentiation environment is ready to support early fetal and initial placental development. So maternal nutritional status influences the nutrition partitioning to the placenta or the fetus, which subsequently affects the disease risk. So I would like to explain everyone that maternal nutrition plays a very important role, and preconception and throughout pregnancy has an impact. Has a very important impact on pregnancy outcomes and fetal growth. So only if the woman is healthy and if her nutritional status is really good enough, then only she'll have a very good chance of having a healthy pregnancy, not just throughout pregnancy, but even she'll have a high tendency of delivering a healthy birth weight baby. So preconception nutrition plays a very important role because women have to ensure that their nutritional status, their overall health status is good enough, because in the childbearing age, like in the reproductive age, it's really important that they maintain a healthy balanced diet so that they don't have any complications in the future.
What should a girl eat as a part of her preconception diet?
So there are certain important nutrients which the young adolescent girl should keep in mind while following a balanced diet. The three main important nutrients are iron, folic acid, and protein. I mentioned about iron because in India, I see most of the women of the reproductive age group having iron deficiency. So in order to prevent iron deficiency, they need to consume iron-rich foods in order to maintain their hemoglobin levels, because every month, as they're going to lose around 15 to 30 mg of iron because of the cycle, and even in the pregnancy outcome, like even during pregnancy, for the 9 months, they won't have any menstrual cycle or something. But after delivery and all, there is loss of blood. So in order to compensate for the iron, for the blood loss, they have to ensure that their nutritional status is really good enough by consuming iron-rich foods. Iron actually helps in maintaining the red blood cell production. So they can consume iron-rich foods like dark green leafy vegetables, meat, liver, poultry, all the non-vegetarian food items. And coming to folic acid, in order to prevent neural tube defects in the future, it's important that women consumes folic acid rich food items. And even calcium plays a very important role. Calcium is again an important mineral which is important for the woman's bone development. And even protein rich foods have to be consumed by the young adolescent girl, so that in the future she'll have a high tendency of giving birth to a healthy birth weight infant.
What is the importance of eating well during pregnancy? Why nutrition is so important during pregnancy? Can you please help our viewers to know about this?
Yeah, so right nutrition is important during pregnancy because your baby's growth and development is dependent on your diet. On your nutritional status. So the term eat for two is not at all true during pregnancy, because many people have a false misconception that they need to eat food for two. So that is not at all the right way. It is important to consume a healthy, balanced diet, and eating during pregnancy doesn't mean overindulgence, but it means that you consume a wholesome, balanced diet to meet the increased nutritional requirements during pregnancy, because all the nutritional requirements go up during pregnancy. Like almost the caloric value increases from 350 to 500 kilocalories per day. And again, it keeps differing from different trimesters. So a compromised diet during pregnancy can lead to inappropriate weight gain. It leads to multiple nutrient deficiencies and pregnancy complications in mothers, while babies could be born with low birth weight and congenital malformations. Like probably small children or babies might be born with very low birth weight and congenital malformations, like with a hole in the heart or some sort of deficiency, or with jaundice. So there are many pregnancy complications which are interlinked with diet. So around 50 to 90% of pregnant women in India, they have iron deficiency, anemia. So low birth weight babies and maternal deaths are the major consequences of anemia. So in order to prevent this, nutrition plays a very important role, especially the right nutrition. They should ensure that it is important for all the pregnant women to consume a healthy, balanced diet and take nutritional supplements as prescribed by the dietitian. They cannot just choose whatever they want to eat and end up either overeating, or they might lack some nutrients. So they need to get a clarity on what to eat, how much to eat, when to eat, and what are the important food items to consume. So like we have a food pyramid, especially for pregnant women, like along with portion sizes, like cereals and millets. They need to consume like 9 portions per day. Like each portion size is around 30 grams each. Now coming to vegetables, they need to consume around 100 grams each. Like vegetables are like 3 to 5 portions per day. And when I say vegetables, they should include dark green leafy vegetables and different types of rooty vegetables. And coming to fruits, they need to consume at least 2 portions of fruits per day. When I say 2 portions, each portion constitutes about 100 grams each. Then milk and milk products, at least 5 portions per day. That means at least 500 ml of milk and milk products should be consumed per day, especially by pregnant women. Coming to protein-rich foods like pulses, eggs, meats, and fish, at least 2 portions of pulses and 1 portion of non-vegetarian food, which constitutes about 30 to 40 grams each. Then coming to fats and oils, 6 portions per day, like at least 5 ml. 5 ml consists of 1 portion size. Then coming to sugars, at least 4 portions per day, 5 grams each. So when I say sugars, I'm very cautious about it. I'm talking about the natural, healthy forms of sugar. So the pregnant woman should understand that only if she consumes a healthy, balanced diet, she will be able to give birth to a healthy birth weight baby around 3.5 kgs without any complication. And she'll have a high tendency of, going through a normal delivery rather than a C-section. So these are some simple tips that why a pregnant woman should eat well during pregnancy.
Hope you guys found this knowledge useful. See you tomorrow with another interesting video. Like, share and subscribe my channel.